Andrea Dalzell is the first registered nurse in a wheelchair to get through nursing school in New York City. Andrea is known as a pioneering activist for people with disabilities. She has emerged victorious against all the obstacles in her path, including being diagnosed with transverse myelitis at a young age. She did not allow her disability to become or define her. Andrea completed an undergraduate degree at the College of Staten Island, majoring in biology and nursing. She was the first to complete the nursing program using a wheelchair for any CUNY school. As an advocate and activist for the rights of people with disabilities, she garnered various awards. She was awarded CUNY's Emerging Leader of the Year Award and also received the Cindy Lou Disability Rights Advocate Award in 2015. Aside from juggling her career as a school nurse, she finds time to travel and spread awareness for issues that affect people with disabilities, such as health, transportation, accessibility, and gender disparities affecting the LGBTQ+ community within the disability community, amongst many more. Andrea was crowned Miss Wheelchair New York 2015 and utilized her title and platform, Life, Liberty, and the Pursuit of Access, to promote her message and belief that people with disabilities can live a fulfilling life. She has recently been featured on Good Morning America, Access Hollywood, Forbes magazine, and previously with O Magazine, Apple, and other publications and media outlets. In her commercial with Apple, she inspires the innovative addition to the Apple Watch to track pushes instead of steps for everyone who uses a wheelchair as part of tech inclusion. Andrea is becoming a household name, and it is such an honor to welcome her here with us today. I'm gonna show her commercial, so give me a second for technology to work with me.
I have a huge responsibility to be out in the world.
21 seconds, just like that. One more.
There's some other little girl who's out there who doesn't see a teacher, who doesn't see her doctors looking like her. Completed all my rings today, okay? Can I just, I did, look. How is she supposed to feel accepted or beautiful if she doesn't see someone like her? I have to do my part here.
Hi, everyone. Oh, my goodness. I know that we are living in a weird time, and had this been last year, I probably would have been in front of you. And hopefully in the near future, this would be an in-person presentation and not on Zoom, because I know we are probably all sick of Zoom by now, but we are pushing through. So everyone, I hope you guys are staying safe. As you heard, I am a big name, and a big name that is becoming a household name. And that is in every facet in the disability community, within the healthcare community, and within just everyday life. And I'm going to start at the beginning so you guys actually know who I am and why me talking to you is so important. Like you heard, at the age of 5, I was diagnosed with transverse myelitis. And what that is the inflammation of the spinal cord. And for me, it affected my spinal cord from the T10 level down to the L1, leaving me incomplete paraplegic. So layman's terms, my spinal cord was set on fire like a match. And then when they were able to put the fire out, my nerves that got damaged were from about belly button down. So I used a wheelchair to get around. I didn't use a wheelchair right after my diagnosis. It took some time to get into that. But at the age of 5, can you imagine what that is for a 5-year-old to now be pushing around in a wheelchair? I can tell you, for me, it was like riding around on Hot Wheels. When you really want to think about how kids accept their disability, they don't know anything else. And all kids ever want to do is play. And that was my life. At a young age, okay, something drastic has happened, but it wasn't me that was directly dealing with it. It was my family. My family had to worry about how the world was going to accept their daughter using a wheelchair or having a physical disability. And for those that have disabilities, you can attest firsthand that it's your family that really deals with the bulk of some things that you want to push away, some things that you don't want to deal with yourself. It's your family or the friends that are close to you that pick up how am I going to make sure that they can get through certain situations? And then they try to help you navigate through that. That's how it was for me until I actually had to use a wheelchair, sit in a wheelchair full time. When I was 12 years old, I had my first spinal surgery. And right after that, I was a wheelchair user permanently. And for a 12-year-old, imagine this is high school years. Oh my goodness, I'm going to have a wheelchair that I'm using in school, in high school. I'm already picked on half the time because I was using crutches before that. Junior high school was not great, but I'm going to have to worry about being in a wheelchair for high school. This is the pivotal moments of my life. And this is where I want you guys to pay attention to wording. So right before I get to high school, I have my surgery and I'm about to graduate junior high school, and I am allowed to leave the hospital to go to my graduation. And I'm at graduation, and my doctor writes in my memory book, "Please, Andrea, don't become a lawyer." I said, why not? Because I think he knew at that moment, everything that I had been up to until 12 years old and graduating junior high school, he knew that I was going to come back and sue him. I was a lawyer, right? I'm going to be a lawyer. I'm coming back. I'm going to sue him for all the pain that he's ever put me through. And that's what he writes in my memory book. So automatically my mind is shifted. You don't want me to be a lawyer, but you've been a pivotal person in my life since 5 years old. So what do? I'm going to mimic you. I'm going to become a doctor too. And then I'm going to figure out how not to cause pain to people. I'm going to be a better doctor than you. This was the whole thought process that I had as a child. I'm going to be a better doctor, and I'm going to cure pain. I'm going to cure cancer. I'm going to cure everything because I'm just going to be a better doctor. This was the mindset that I had going into high school, on top of having to worry about my disability and be popular. How am I going to be popular? How am I going to be accepted? How are people going to be able to move around the way I'm moving? And are they going to be able to accept me? Well, fast forward, I'm starting high school. And in New York City, how high school works for someone with a disability is that you can have a bus pick you up from your home and drop you right to school. And for me, the yellow bus, I don't know about anywhere else, maybe in California too. Students, please let me know if this is a thing for you too. If you're taking the yellow bus, you're considered the nerd. You're not the cool person. You're not the one that gets to stay with the after school programs, because you're going straight from home to school and then school to home. There's no hanging out with your friends. So again, the yellow bus for me was, what? I have to take a yellow bus. Okay, this is what it is. I'm getting off the yellow school bus and I'm going into school, and I'm seeing my peers walking across the street to a deli, walking across the street to go get breakfast and hanging out before the school bell rings. Why am I not allowed to do that? That's all I can ever think was, why couldn't I be with my friends? And when I would ask, it's like, no, you can't, because you have special education privileges. I didn't know if that was a privilege, but for me, special education became a rope that kept me stuck somewhere versus allowing me to develop and grow and be a human being, be a teenager, be someone that wants to be social. No, it was something social restriction versus social interaction. And I said one day that I was going to get off of this yellow bus and I'm going to go meet my friends. And that's exactly what I did. The yellow bus picks me up, drives me to school. And as that lift is coming down off the bus to get me off, I beeline to the corner. I want to get to that corner as fast as I could, so that one, the teachers can't catch me. I'm on wheels. How are they going to catch me? And two, let me get far enough away that by the time I like reach somewhere, they won't be able to get me and I can go get my breakfast without a problem. This is my mindset. So I said, okay, I get breakfast and I come back into the building. And as soon as I'm coming into the building, I'm being told by security that I have to go to the principal's office. All right, I'm in trouble. I don't know what I'm gonna do. What is my excuse? I'm just gonna say that I'm hungry. Mind you, again, 12-year-old thinking. How do you get out of being in trouble? You try anything under the sun. And that's all I wanted to do, is to make sure that as I was going back into the school and I'm gonna sit in front of the principal, what am I gonna say? The principal says, Andrea, do you know why you're in the office? And I said, no. I knew why I was in the office, but I told him no. And he said, you are not allowed to get off of the school bus and leave, because once you're on the school bus, you're considered school property and you need to make sure that you're safe. When you get to the school, you're again on school property until the end of the day, back on the school bus and you go home. So you cannot leave. We need to make sure we know where you are. I was like, you don't do that to other kids. And they were like, well, that's the rules for you. And I was like, well, what's the difference between me and other kids? And that was, your special education, you have an IEP, you have to take the school bus. This is, well, I don't want this. Well, you can't just get rid of it. This is the conversation that's being had. And I'm being told that I'm being penalized for getting breakfast. And I was like, well, I'm going to do it every day. I was going to do it every day. I set my mind. I told the principal within a split second that I was going to do it every single day. So he calls my mom. And he's on the phone with my mom. And my mom is saying, well, just give her a Metro card. And in that moment, I was empowered by my mom to say, hey, I can literally decide that I don't need to take the school bus. And then she takes it away from me and she says, the minute one day comes and you're late to school, you'll be back on that school bus and you will never ask me to have a Metro card again. I said, okay, there's a deal. Now there's a lot to that. Remember, I live in New York. So we have snow, ice, rain, inaccessible transportation, inaccessible curb cuts. And I have to make sure now that I'm leaving my home on time to get to school. If not, I'm going to be put back into social restriction on a yellow school bus. And I couldn't have that happen. So therefore, I said, sure, no problem. And I figured out a way to make sure that I was at school on time every single day. Now, did my teachers like this? Not at all, because I was combating what they were trying to say. No one had ever pushed the button to say, well, students are not allowed to go to the deli and this is why, and let's give them privilege to be able to show independence that way. But I pushed it and I got it. And that kind of shaped the way my high school career went. I was now allowed to stay after school for after school programs. I was now allowed to be early and be a part of like student council meetings. It kind of shapes the way you experience your high school life. And the way I'm starting this is because high school is a pivotal moment before anyone even gets to college. This is where your influencers come in. This is where everyone can remember that one teacher in high school that was either the meanest person, but really showed them a way, or the nicest teacher in the world. And they say, you know, you have a future. Well, for me, past that moment of using a yellow bus to get to school, I was faced with the leadership of my school constantly trying to put challenges in front of me. So one afternoon, it was snowing. After school programs had been canceled. And I had called my dad already and let him know that I needed to be picked up from school because I wouldn't have been able to roll through the snow home. And he said, fine, no problem, I'll pick you up. And I waited in the back hallway of the first floor, right where the admin suite is. So usually the principal, the vice principal, and I'm just waiting for my dad on that side. And a teacher is walking down the hall and she says to me, why didn't you tell me you were still here? I could have gotten you on a yellow bus home. And I looked at her and I said, I didn't know because I don't take the yellow bus. I already have someone coming for me. And she was like, well, you think you know it all, don't you? You know you have 3 strikes. And I looked at her and I was like, what do you mean? Like, again, typical teenager, we're rude, we're chatty, we talk back. And I was like, I don't need your help. And she's like, you are Black, you're in a wheelchair, and you have a disability. You think that this act that you have now is going to get you far. It won't. I didn't know what she meant then, but it was something that stuck out to me. You told me that I am a woman, I'm Black, I have a disability. I don't understand why these are negatives, not at that moment, but for you to say it, it must mean something. She also then said to me that I would never go farther than a community college. I will not go higher than community colleges because people with disabilities don't go to big universities. We don't go and get higher degrees. You might be a social worker. You might be in psychology, but your hopes and dreams are a little far-fetched. Okay, no problem. I got in the car that afternoon and I think I was the quietest child ever in the world because until that point, all I saw was my disability. All I knew was that I had challenges with my disability. Nothing else mattered. Not that I was Black, not that I was a woman. It was just, okay, how do I get my wheelchair up some steps? How do I pop a wheelie to get off a curb cut? How do I make sure that when it's icy, I can navigate the world? I wasn't thinking about anything else. So these are all major moments in life where it made me second guess what I was supposed to be doing in the world. Who was I going to be? We question ourselves this way in high school. We question ourselves in college. We question ourselves like this past adulthood. But to have a child question it from the age of 12, 16, 17, these are markers. These are markers that are going to live with them going through life completely. So let's shift gears a little bit. I ended up having 4 major surgeries on my spinal cord because of the fact that I had rods placed. And again, I'm rambunctious. I'm doing whatever I want, playing basketball, wheelchair racing, and I break my rods. They fix it. I break my rods again. They fix it again. And then I ended up getting them infected and they had to take them out. So I spent my sophomore and junior year of high school sick. I'm at home doing all of my schoolwork from home, and I still pass and I still get a Regents diploma. But in my senior year, I only had 6 months into my senior year that I was actually physically in school. And I wanted to do everything that everyone else wanted to do. I wanted to go on the senior trip. I wanted to be a part of the dances and the proms. And everyone is like, yes, Andrea, you can all do it. All of my friends are like, we're so happy you're back. And teachers are like, Andrea, you can't go on these trips. Andrea, you can't go to prom. Why can't I go to prom? Well, if you go to prom, your tables are all going to be in the back of the room where it's closest to the exit. Why? Why do we have to have our own tables? I pushed back so much that I decided to stop talking to the teachers and start talking to the students. That was another pivotal moment for me. Stop talking to the people at the top, start talking to your peers. Because when you talk to your peers and you get them on your side, they can then speak for you as well, right? They now understand your plight. When I told them, hey, they were going to place all of the students with disabilities on the back tables of the prom, they were all like, why? Why can't we just put it around the perimeter of the dance floor instead? That way you guys all have easy access to leave and go, but you're intermingling with the rest of the students. This wasn't brought up by a teacher. This was brought up by other students. This was brought up by talking to my peers and saying, I don't want to sit at the back. I've already told that I had already been told that I would not have been there prior. Now they're trying to make accommodations by putting us at the back. Why? So in speaking to student council, they made it so that all of the students with disabilities that were visible, canes, walkers, wheelchairs, were allowed to sit and intermingle with the rest of their peers. So there you go. I started my advocacy work and I didn't even know it. It was like, okay, so what next? What else can I change before I leave high school? Well, I changed the way the College Now program went about. We have a College Now program that allowed for students to take college classes while in high school. And it wasn't offered or brought up during any resource room or any college events at the high school. So I was like, well, why isn't all of my peers who have special needs, why aren't they a part of everything? And they're like, well, they have the busing issue. And I was like, well, why can't you schedule busing to just pick them up later so that they can attend an event? Second round of advocacy, they did not listen. Leadership of the school was like, no, this cannot happen. We can't change the bus schedule. And I went to the students, and the students said, we can't change the bus schedule. We just have to pay them more. So then we held a fundraiser to be able to pay for the busing to just go later. These are all moments in time where you're like thinking as a kid, okay, I just did something, but you're not thinking about the gravity of what you've done. You're not thinking about the impact that you're giving to someone else. To be able to say, well, they can attend a college event. Maybe this is something they weren't thinking about before, but now they are thinking about because they're meeting with a college recruiter to say, you can go to our school. We do have disability services. We do have accessible buildings. Yes, this can be made accessible for you. Now I'm talking in terms of someone who is using a wheelchair, but this is expensive for anyone who may have auditory challenges, may have hearing impairments, anything and everything. All of our colleges, we know that they can supply services, but usually in high school, you're not hearing about this. You're not being taught that college is an option, at least not in New York City. And it wasn't for me at the time. Again, I had already been told I wasn't going further than a community college. So I said, sure, no problem. I ended up graduating with a Regents diploma here in New York City, and I got accepted to college. So CUNY, all of the CUNY schools actually accepted me. CUNY is the City University of New York, and there are 36 colleges. I had gotten an acceptance letter to all of them. And I decided to go to the College of Staten Island because it's the one school in New York that actually has 98 acres of land, not just buildings. If you think New York, you're thinking big buildings. My college actually had little buildings and grass. So it was a great go between. Instead of saying, I'm going into the city for school, no, I was going to an island and I actually saw grass and I was able to be outside for a good portion of our year. And my college is fully wheelchair accessible. I was able to not only go to a bathroom on every single floor, I picked a college that was literally going to have things laid out for me. There was a ramp in front of every building. There are accessible water fountains. There was a disabilities office. There was a diversity office. So all of these things played into how I picked my school. I started in 2009 and got really, really sick. And that is because I decided to not listen to my body. I was so gung-ho on saying that I was going to graduate college, that nothing was going to stop me. I am going to finish school on time, 4 years, the dream of every college student to just get through and finish with grades that are acceptable to get into the real world, right? This is what we're thinking. And for me, it was more along the lines of, I'm sick, but I'm gonna ignore this and I'm gonna go to class. And I'm gonna wake up at 6:30 in the morning and travel to school 4 hours with a fever and sit in class and think that I'm going to do well. And I wasn't doing well. I ended up failing my first 2 classes because of the fact that I wasn't listening to my body. I was putting my social needs and my wants in front of what I actually needed to take care of. I needed to take care of my health. I needed to put my health first. Oftentimes we think that something is can be put on the back burner and not follow up with it, not find a doctor. I don't have a doctor, I don't have insurance. Let's put it on the back burner for now. And I'll come back to it in a month. And then a month turns into 5 months, and 5 months turns into a year. We all do it. We all do that one thing with our health that's like, I shouldn't do it, like going to the dentist, okay, going to the eye doctor, getting a hearing test. These are all things that we put off all the time. And we think, oh, we'll just catch up to it until it catches up to you. And there's one lesson there. It's listen to your health first. I refused to listen to my health until it was almost too late. I had ended up having a bone infection, that osteomyelitis for my nursing students, that took me out of school. I ended up being out of school for almost 4 years and I almost lost my life. I had to figure out in that time frame what I was going to do. I left school, retreated, tried to heal, had almost 16 surgeries from that one infection, and then was home saying, there's no point on going back to school if I'm going to constantly get sick. There was no point in going back to school if I was going to have put my body under stress and it was going to fail me. All of these things come up into your mind where you think that failure is going to be your only option. Now, remember, I've already heard failure. Failure was told to me when they said that I was a Black woman who has a disability and I wasn't going past community school. So it's already put in my brain that I'm not supposed to get far. So, okay, if my body is failing me and I am not able to go to school full time, what's the point of me doing this? Where do I find the motivation to say, well, I'm going to get up and go to school? I had no idea. But I do know one day, particularly, I had gotten a letter from Social Security telling me that I owed them close to $3,000 in back payment. Oh my goodness, I only get $800 from you a month. I don't work any other jobs. I wanted to go back to school and you're telling me I owe you $3,000. 800 can't become 3,000. So therefore, I don't know what I'm going to do. I'm panicking. I'm talking to my parents. How do I figure this out? Want to know how I figured it out? I went back to school and got a school loan. I used that school loan and I said to myself that I was going to take one class at a time and see how I handled it, because I needed to pay back Social Security and I needed to make more than $800 a month because it wasn't going to add up. I know for those students that have disabilities that are living off of Social Security, understand that it is very hard to make ends meet when you are only getting supplemental income from the government. And you're dependent on getting Medicaid and Medicare from the government based on your income. So I'll jump into that a little bit later, but I'm putting that out there now. So for me, it was like, okay, the only way to get through this is to get through school, because school is going to be my ticket to making money, to getting insurance and ensuring that I'm okay. So I took up biology. I went back to school. I'm studying biology and I'm doing one class at a time. I went back to school in the summer and I took a math class, and that math class was for 6 weeks. And I said, okay, if I can get through this math class, I can get through 2 classes, right? And so on and so forth. And that's how I built myself up. By the following summer, I was taking on a full course load and I was able to get through school. I was able to say that I am healthy enough, I'm taking care of myself, listening to the days that I need to have a day off and saying, well, I am not going to get up and go. I am not going to answer the phone, or I'm going to write my professor and tell them I'm having a really bad day. My pain is really bad, whatever it is that's going on, and letting them know this is what I'm willing to do in order to make up whatever work possible to be in your class. So that opened up my lines of communication, making sure that everyone that was in my tribe, to ensure that I was going to graduate, to ensure that I was going to do well or be successful in their class, I was having an open line of communication with from the very inception. Now, people will probably say, oh my, you don't have to disclose your disability to someone. You don't have to talk about what you don't want to talk about. And that's totally true. But also remember that people don't know where you're coming from. They have no idea. They don't know how to empathize. They don't know how to correlate with you if you don't speak to them at a level in which they can understand. And they're not coming from pity. You're not coming from pity. You're not looking for empathy. You're looking for equity. You're looking for an even playing field. You're looking to be accepted in a term that fits you and that professor. A contract. That syllabus is a contract. You can have a contract outside of the syllabus with your teacher that says, I'm allowed to miss a day, and these are the things that I will do if I have to miss your class in person. You can bring this contract up with any disability office, have a meeting with your teachers. And this is something that I did. I made sure that my teachers knew that, you know, if I needed an extra day, that I was going to take that extra day because my pain was bad. And I would make up work. I would do an extra discussion post, or I would ask to Zoom in line. Well, we didn't have Zoom over then, but it was FaceTime. My friends would use a FaceTime on an iPad for me to be in class, or I would ask for a note taker to at least be able to get the notes from class. All of these things were uh, all of these things were major factors in my own communication lines. So I'm graduating with my biology degree, going through school, getting good grades, figuring out a way to be a part of the student body life, having a voice. I joined student government, and I said, you know what, our students need to have a way to understand the gap or the bridge when they're coming out of high school and into college, because it's a transitional area and no one knows how to really navigate that, whether you have a disability or not. So we started a program with our student government where students coming in with a disability will be partnered with peers that had already been on our campus to be able to go around, to be able to see, explore, and be a part of what campus life would be. And then help with that transitional period. Also partner them up with students who are already a part of their program who have disabilities, so that they can understand how to navigate that program that they're in. Certain things weren't accessible, but how did they make it accessible for them? So I graduated with my biology and neuroscience degree in 2016, thinking that I was going to end up being a teacher because I didn't know what else to do with my life. And I didn't want to be a teacher. I didn't want to work in a lab. I didn't know what else to do. What is accessible to me? I had no clue. It's not spoken about. Jobs, employment for someone with a disability, I don't even see it. There's no representation of it. What am I supposed to do? It's all I kept questioning. Again, this question comes back to junior high school, high school. What am I supposed to be? I was told not to be a lawyer. I was told that I wasn't going to be much of anything because I'm Black, a woman, and have a disability. I'm not supposed to even be graduating from a four-year university. So what am I going to do next? I have no clue. I am going on for medical school. I decided that, okay, I'm going to take my MCATs. And right before I decided I'm going to take my MCATs, I decided to audit a class. I audit a medical school class, and I'm sitting through the class, and everything that the medical model is talking about is a disease process. So now here I am, a young woman with a disease, and all you can see is a disease process. That's all you're learning. Medical model teaches you the disease process. It does not teach you about the person that's sitting in front of you. It does not teach you about the person that is going to be, a person outside of your office, who's going to be the mother, the father, the sister, the cousin, the doctor, the teacher. They're not teaching you. That's not how medical school works. It's only teaching you about diabetes. It's only teaching you about the effects on these cells, how this is moving throughout the body. How are we looking at it? How do we treat it? And then medications and so forth. And I already lived that life. I don't want to ever go into someone's room and tell them they can't do X, Y, and Z because they have been diagnosed with Y. Like, I just couldn't do it. It's just not something for me to be able to convey very well, especially knowing how it has been conveyed to me my whole life. So what do? Change gears. And I'm like, okay, well, nursing school. Started talking to nurses, started talking to faculty members, and all of them are saying, I've never seen a nurse in a wheelchair. I don't know, not sure. Okay, well, I take the pre-LNN, and then I waited 1 year before I actually submitted my application to nursing school because I really had no idea what I was going to be doing with my life. I had no idea what I was going to be able to put forth. So I apply a year later and I get accepted. Oh man, I'm accepted into nursing school. I have no idea how this is going to be going. And then I go into mandated orientation. I'm there. I'm thinking, oh my goodness, I'm going to be a nurse. And I hear, excuse me, what's your name? And I'm like, Andrea. And they're like, okay. And they leave and they come back. Hey, excuse me, Andrea, can you step outside real quick? And I was like, yeah, sure, no problem. I go outside the room, and it is the director of the program, the assistant director of the program, and it is a professor that is there. And they say to me, well, Andrea, we're not sure if you can be a part of the program. With your disability, we're not sure if you will be covered with our insurance. We're not sure if the hospitals will have you. You can leave and we will follow up with you as soon as we get some answers. Now, I'm at a mandatory orientation for nursing school and you're telling me I can leave because you're not sure. I repeated exactly what they said to me back and I said, you know what? The ADA says that I'm covered with education, so you would kind of have to figure that out, but I'll stay for orientation and then we can figure it out afterward. And they were like, okay. So orientation finishes. I don't even talk to them. I am lucky enough that I have a diversity officer on my campus. I am lucky that I have an accessibility office on my campus, and that's exactly where I go. I go to the director of student accessibility and I say, I was just told that they don't know if I can be in a program that the ADA says you have to accommodate me for because they already accepted me. And he looks at me like, what are you talking about? I was like, well, you figure it out. And I left his office and went straight to the diversities officer's office. And I said to her, and I was like, they just told me I can't be a part of the program. What do I need to do to make sure that I'm going to be a part of this program? And then a lot of conversations happened without me there. And then when I realized conversations were happening behind me for this whole week that they need to figure out how I can be a part of a program, I'm sending emails. Have you heard anything? What is going on? What do I need to do? No one is answering me because they're talking amongst themselves about how it is that they're going to have a student with a disability. They can't deny me. It's against the ADA. They know that I know that. So now how do they ensure that I can do it without having my voice at the table? So I knew something was happening because I would see them leaving the buildings. The diversity officer, the accessibility director is not going to be going into the nursing building for just any reason, especially if I'm the first student to be there. So I sent a joint email to all of them and I said, I'm not sure what is happening, but I do not wish to have decisions made on my behalf without me there. I'm not sure if this is what's happening, but please include me in the conversations. And that was just a simple email that I sent. Now, this sounds very brave and brazen for someone to be able to do, especially for a student who might not feel like they can speak up. But for me, it was something that I had already learned to do. Remember, student council in high school, it was something that I learned to push the envelope with already. So they allowed me to come to class, and I literally said, please just allow me to figure it out. We can figure it out together. However this is, we're going to figure it out together. And trust me to let you know when something is wrong or when I can't do something. Allow me to speak and let's brainstorm it together. And they were like, okay, fine. But every single course that I took in nursing school, I was questioned. I was never allowed to be a student, whatever that means. So for my nursing students that are watching, you understand the rigorous routine that nursing education actually is giving to you. You are understanding just studying for 6-7 hours a day, how taxing the program can be. I know that even just getting through that very first foundational class, it's almost like you're learning a new language. And for me, I was not only learning a new language, I was learning new body mechanics. I'm learning how to use my disability in a world that's supposed to be built around treating me. I'm now learning how to do that flip side and do it amongst professors and clinical professors and nurse managers who don't think that I can do it. How many times am I going to be told no and have to continuously prove myself and say, I can do it, give me a chance? So every semester, I knocked it out of the ballpark. I didn't give them a reason to say she can't do it. I took up boxing to be able to do CPR from the seated position. Boxing is stamina. It's continuous punching. It is building your muscles that you need. Think about it. When you're pushing on someone's chest, you need to have a lot of muscles, okay? So I took up boxing to be able to do that. I also took up just making sure that I was shadowing other nurses, making sure that I was able to stay a little bit extra and figure out in a clinical, non-clinical setting, maybe in a stimulation lab with a professor, how I'd be able to move a patient. And having some professors actually want to figure things out with me, wanting to spend that extra 20 minutes after class to say, okay, let's review this. How would you do this differently? Or how can we make it so that you would be comfortable? I only had one professor that really did that, and I'll shout her out here. Her name is Professor Maida. I shout her out all the time. We all had that one professor that really, if you open up to them, they will be your biggest cheerleaders, especially in college and any profession that you're going for. And Professor Maida for me was my biggest cheerleader. She was like, I've never seen it, but I've been in the profession for over 35 years and it's time for change. So for me, that was the biggest gift that I could have gotten. She wanted my success. And because she wanted my success, she went above and beyond to make sure that I was getting what I needed to get through the program. I got through nursing in 2018 and I passed my NCLEX in 75 questions. For all my nursing students, we all know 75 questions. What? Check. For everybody else, just know it doesn't matter as long as you pass, okay? As long as you pass, that is the goal. So in 2018, I passed my nursing exam. I passed the NCLEX. I am a registered nurse. Wow, I did it. All these no's, I'm here. I did everything that they said that I couldn't do. And then I'm thrown into the job market. And the job market says, wait a minute, you're a nurse on wheels? This isn't gonna work. I don't understand how you could be a nurse on wheels. I don't understand how you're going to be able to do CPR from the seated position. I don't know how you're going to be able to hang an IV bag. How are you going to be able to turn and lift a patient? How do you clean patients? All of these things that I have already proven through clinical practice in my nursing program, I'm now being questioned about again in the real world for employment. In the real world, in clinical settings, I wasn't passed through nursing school, but for some reason, everyone thinks that I can't do it, even though I had just proven that I could. I'm like, man, now here's where things start to shift for me again. Remember, Black, woman, disabled. What are we going through right now? We're going through all of these civil injustices. We're going through women equality. We're going through trying to make sure that people with disabilities are getting employment. We are at 17.9% unemployment when the rest of the country is at 13.3%. We have the highest unemployment rate and we're the largest and fastest growing minority in the world. And I have 3 boxes. So that teacher wasn't far off when she said that I had 3 strikes, because I hit all 3 strikes when we're going through the major movement that we're going through now. And here I am, job hunting, going through every single interview. And I'll tell you this, my peers, I was getting interviews first. I had made sure I had a person do over my resume. I made sure that it was immaculate. And I was like, okay, I'm going to get these interviews. And I got interviews, but I wasn't getting the jobs. And then my friends were getting the interviews after me and getting the job. That's how I knew something was wrong. I knew something wasn't quite right. Why is it that when I'm sitting through an interview, you're not really questioning about my disability, but you've never seen someone like me before? You should kind of question it so that you know how we can communicate and how we can put through accommodations for me to be able to do the job if you think that that's what I'm going to need. Accommodations are a part of the law. You kind of have to do it, but then HR shies away from it. So it was up to me again to start addressing my disability in the real world. How do I do these things every single day? How do I take on being a nurse from the seated position in hopes that I can get employment? Kind of shifting, it's like 10 interviews in, okay, well, maybe it's me. Get an interview coach. 25 interviews in, okay, it's not me anymore. There's no way. 35 interviews in, okay, I'm going to address the disability. I'm going to address if they have questions. I'm going to start asking, I'll see the floor. Can I move around the bed? Can I move the beds? Like, I am now addressing every single part of my disability in every single interview. And these are things that I have done all of my clinical practice. Why am I doing it again? And it started to hit me that, you know what? I've never seen a nurse in a wheelchair. I knew that before, but if you don't see us, you can't even fathom it happening. So if you can't fathom it, you're going to question if a person can do it. And that's all I was up against. I'm up against everyone else's imagination thinking that it's impossible to have it happen. But I had already proven the impossible. I made it happen. Can you just give me the chance? Now it's like I'm begging for a chance. And I was like, you know what? I don't know what to do anymore. Now, 76 interviews in, COVID strikes. It's a year later, and I get my first job as a nurse at a major medical center here in New York City because I am the only one that not only has my ALS, my BLS, my PALS. For all of you guys that don't know what that is, that's basic life-saving skills, advanced life-saving skills, pediatric advanced life-saving skills. I have ventilator certifications. I've had IV certifications. I have a long list of certifications behind my name because 76 interviews. Hello, I got to make myself marketable. I'm like, why am I not getting a job if I have all of these certificates behind me? But COVID happens, all nurses on deck. I apply. I didn't apply. I get a hospital put out their telephone number, and I called, and 15 minutes later, they called me back and said, can you come in tomorrow? Oh my goodness, I've got a job, and I'm thinking this is great. At the same time, I'm also thinking the ball's going to drop. They don't know I'm in a wheelchair. So I try to hurry up, get there, get credentialed. I'm given a badge, and I show up the next day for my half-day orientation before I go to associate myself with the unit. And I'm thinking they're going to see me and they're going to say no. And they saw me and they were like, do you need any accommodations? And I was like, no. And this is great. I'm now going onto the floor. I'm going to the hospital and I'm going to work. And I'm on the floor and I'm getting a report and I'm starting to acclimate myself to the unit. And the assistant director of the hospital unit comes up to me and she's like, I need to see you off the floor. And I was like, okay. And I get pulled off the floor and she says to me, have you ever been a nurse on the floor before? And I said, I've done all of my clinical practices and I'm pretty much a lifetime patient. So of course I know what the floor is going to be like. And she's like, it's a little different. And I was like, I don't see how, but if you have questions about my disability, did you bring it up with HR before you came to me? And her tone changed. She looked at me and she was like, I hope I didn't offend you. And I said, well, you didn't offend me, but I think your questions are more for HR and not for me directly. And that's when tone shifted again. I knew what I was talking about. I'd already gotten hired. I've already gotten credentialed. Are you really going to be able to kick me out? Past repeated itself. I went through nursing school and this happened. And now I'm on a whole unit. And you're looking at me as if I'm a liability versus giving me a chance to say, yes, she can do it. We've given her the chance. I'm not questioning her ability. I'm not questioning how she's going to do it. I'm just giving her the chance. Well, they gave me the chance. And not only do I have glowing recommendations from all of the nursing staff, I got the Craig H. Nielsen Foundation Visionary Prize Award because of my tenacity to keep moving forward and challenging the status quo. All of my life, I have been told I wouldn't be able to do something. You shouldn't be able to do something. You yourselves are telling yourselves you can't do it. I'm telling myself I can't do it. There's no way it's going to happen. I don't see it, so therefore it's not something that can go through. When in actuality, it's literally having the conversation. It's having the communication. It's being able to say, this is what I need. This is what I can do. How can you meet me halfway? It was all about compromise. It was all about being able to understand what someone was telling me and how much of it was going to actually impact me and how much of it was just going to be for them. Because remember, people love to project their own thoughts onto you. They love to be able to say, well, you know what? If I can't do it, then you can't do it. But that's not the case. We're all individuals. You all have to take a moment to say, can I do this? And if you're going to say, yes, I can do this, then do it. Figure out your way, figure out your path, have those conversations, start talking to people who have done it. And if they haven't done it, start brainstorming what could work. Because sometimes we have to create our own paths. I clearly created my own path without even knowing that I was creating that path. Every no that I had hit just said, hey, okay, fine, I'm just gonna do it another way and another way. Or I'm gonna ask another person, or I'm gonna talk to someone else. Because I needed to know that it wasn't going to be just one person's no determining my future. It was going to be multiple yeses that set my path. And the yes had to start with me. So I say this to all of you guys, all of you who are in school, all of you guys who are starting school, all of you guys who are in nursing programs, biomedical programs, those with disabilities, those with invisible disabilities, or just being you. Choose your yes and fight like hell for it.
Andrea, thank you so much. There are a couple of questions coming in, and the first is from Veronica King. She says, whew, your story is, I added the whew, your story is so inspiring. Do you have any advice for getting through nursing school? And before you answer that question, I want to acknowledge Darwin Brown, who is interested in asking you his question himself. So after you finish this one, I'll take him off mute, okay?
Sure, no problem. So nursing school is a beast, okay? Remember, you're not looking to pass the NCLEX tomorrow. You are working towards passing that exam, but right now, your focus needs to be on just that one class that you're in. When I was in nursing school, I made sure that I asked my family for their help. I told them that I was going to be in a program for 2 years and that in those 2 years, I was going to be dedicating a lot of time to my studying. I asked them for lenience on making dinner. I asked them for help washing my clothes. I asked them for help in washing my car and doing certain things and giving me passes when I don't show up to family events. I asked my friends to help me make study cards, especially the ones that could draw. And I asked those that I was a partner to at the time to give me an hour of time of our actual time together to just study, or you can ask me questions, and or that would be my own personal time. That way, those 2 years were me just really focusing on being how to get through nursing school. Remember, I told you I was going through nursing school and having to figure out my disability. So my time was precious. If anyone was going to have that time with me, it needed to be scheduled and booked ahead of time. So definitely I tell you to focus on making sure you have a tribe behind you. If you don't have a tribe behind you, start making friends in nursing school, getting into a group study session where you have scheduled times to meet, and just focus and talk to your professors. Your professors are going to be the ones that help you the most. Go to those office hours, talk to them, make sure that you take a pre-exam, you know where your weaknesses are. That way you can go to your professor and talk about those weaknesses and what you can do differently.
Darwin says that it was an accident that he raised his hand, but he said, I don't have a question, but I want you to know that you're a champion, an inspiration, and a gift. And we do have a couple of questions coming in. The first from Christine. Thanks so much for sharing your story with us. What advice can you give to a pre-nursing student with a medical condition who is concerned about flare-ups of symptoms that may impact attendance and ultimately completion of courses and clinicals within the strict timeline and parameters set up by nursing programs? And then one last point to that, he's heard that if he cannot attend classes or clinicals as scheduled, he would not be able to complete the program and is now thinking about changing a major.
Ooh, listen, if nursing is what you love, don't give that up. That's my first advice. Don't give that up for anything in the world. Second, pre-medical student, understand what your body can handle. Okay, I had to figure this out also. What is my stress level? What do I need to do in order to make sure that my pain isn't going to increase. I had my flare-ups were bad, especially when I was super stressed in nursing school. So then it came down to what were going to be my break days. How was I going to schedule those breaks into my day? If you're worried about just spontaneous things happening, having these conversations with your clinical professors ahead of time, speaking with the director, having a personal conversation where it's not with all of the staff, but at least one person understands what you're going through that can possibly convey. Remember, this is nursing. We know what it is that's happening. When you talk to them, you can even say, do you mind if I would miss this class, but maybe pop into another clinical class? Maybe you'll be the extra student 1 week on a clinical class that's not your clinical day, but they're on that same timeline with you, that you're not missing one. Maybe you're taking the class that meets before and that's the class that meets after, like maybe 2 days. Figure out how your accommodations will look. Get your disability office involved with you if you're getting pushback, because there needs to be accommodations there. We don't know often what accommodations will look like, and sometimes the pushback will be, well, this has never been done before. Exactly. It has never been done before. So how do you know if it's going to work or not work if you don't give me the chance? So understand that you have a voice, you have a right to this education. If this is what you're going to pursue, start to think about what you need to put in place in order to not only stay healthy, but what if you do have a flare up where you can talk to a professor and say, this is what's happening. Can we put these accommodations in place ahead of time?
Andrea, the questions are rolling in now. Marlena says, I hope this has not happened to you, but have you ever been denied care from a patient, and how did you handle it? I think what she might mean is, has a patient denied you caring for them?
So a patient has never denied me caring for them, ever. I have never experienced this. Now, has it probably happened to someone else? Maybe, I don't know. A lot of my patients, when they see me rolling into the room, automatically have this empathy. They know that I know what it's like to be in that bed without me ever having to say a word. And I've heard from a lot of patients that I was the best nurse they've ever had. That's because I'm a serial patient. I've literally had 33 surgeries in my life. So for me, it's a little bit different. But remember, there's a lot of things that can happen without even speaking when you're a nurse. Nurses have this way of having a presence with them. I think the fact that me rolling into the room and having a sense of self and confidence played a huge role in that as well. I can tell you one story where a patient looked at me and started crying because she was a new stroke. She just had a stroke, and she was a hemiplegic, meaning half of her body was paralyzed. And she's crying and she's looking at me and she says, I thought my life was over. And I looked at her and I was like, well, it's only over if you don't want to get up and go to PT. Let's go. And I knew what she meant, but I kept it light, because when you're struggling with your disability or you're trying to figure out what it is that's going to happen in your world, you just have to kind of give them that uplift, right? For me, knowing that I'm rolling into a room where a patient might not necessarily understand my disability, but they know that I understand the pain that they've been through, that's something that most people with disabilities don't often get to feel unless they're in the healthcare profession. So yeah, it's been a ride, but never got told no in that sense.
Andrea, I want you to know, of course, you're not monitoring the chat during this session, but you'll read through the chat at the end, and you can imagine the amount of support and appreciation coming from folks really being inspired and engaged in your story. A couple of more questions, well, a handful more from Rose. Can you, and thank you, Rose, for asking this question. Can you elaborate? And there are a number of disability support professionals in the webinar today, Andrea, so we really want to hear this from you. Can you elaborate on the types of accommodations that were made for you in your clinicals, And, Rose notes, I think sharing the specifics can be helpful to increasing out of the box thinking and helping us really to be more creative in our accommodations.
So, sure. I will be completely honest. I did not have any accommodations while I was in nursing school. My one accommodation was for testing. I had gotten extra time on my testing instead of regular an hour, just because I do have major anxiety, and testing anxiety is terrible for me, especially within the time frame that our nursing school exams were given. Now, that doesn't necessarily mean that I don't know what accommodations are. So for what we were going through in terms of what I might possibly need, we were thinking like, how low does the bed go? Usually in schools that have nursing programs, their beds don't go low. They're usually the older models. They're not Hillroms or I don't remember, Santron beds. Those beds, once you press on the CPR button, those beds hit the ground. Like, they are literally low, and my body mechanics allow me to get over and do manual CPR. So those were things that I was thinking about. For someone who was hearing impaired, there are stethoscopes and apps that allow you to hear breath sounds and watch heart rate rhythms. And these are all things that can be easily found on our national organization, the National Organization for Nurses with Disabilities, and the exceptionalnurse.com. Both of these organizations work one-on-one with students with disabilities and offices who help. So accessibility services with on campuses, they go through all of the accommodations that the AACN have approved, as well as making sure that students are supported. I didn't have this while I was in school. I do know about it now. I also know that in some senses, they have, what is it called? For a couple of our nurses who are missing limbs, especially upper or lower part of their arm limbs, there are different techniques that they use in order to do like injections and or in order to keep sterile field. These are all things that, again, can be found within the National Organization for Nurses with Disabilities. Some accommodations that I spoke about already is knowing how to position a bed, accommodating with getting a parking spot in front of a building, a hospital building, a designated parking spot during a semester for a student that might not be able to walk a whole distance. For someone who is in the actual clinical setting in a hospital, like when I did my OR rotations, we did sterile dressing. There are doctors that are out there that are surgeons in OR, so we followed what their sterile technique would be in order to upkeep. For those that are doing like ultrasound programs or respiratory therapy that were missing limbs, we knew how to wrap their limb in order to be able to do suctioning, or how to place a glove on in order to be able to be in direct patient care. There are many different roles that accommodations look like. I think for every student, it really comes down to the communication about what they can and can't do. I can't ambulate a patient to the bathroom. I am not ambulating a patient to the bathroom, meaning walking them from the bed to the bathroom. So my accommodation was to be able to have a 3-person assist for a patient that would not be able to get up and walk. And for me, if I was doing a full care patient, I'm able to do full care. But if that patient needed to be lifted and they were over a certain weight, I was automatically saying that this patient needed to be using a Hoyer lift. Things like that. These are just regular things that are automatically a part of the healthcare system that we just have to be able to tap into and take advantage of.
Really helpful. Thank you, Andrea. There are a couple of questions, one from Abby and one from Naomi. I'm gonna couple these questions up. So Abby asks, do you have a quote or affirmation that you live by? If so, will you share it? And she thanks you for sharing your story. And Naomi asks, what was your favorite stress relieving practice while in nursing school? It's hard to understand why Naomi may ask that question. Nobody's feeling stressed right now, are they? We're all good, yeah?
Well, if you're a nursing school, or nursing school now, they're a little so I am a faithful person. I have it on my phone. It says, God is within her, she will not fail. So I rely heavily on my faith in order to continue on. Some days are really, really hard. If you're feeling stressed, I get it. I know some days are harder than others. And it's just my belief. My belief system keeps me going. So that's my affirmation every day. I'm sorry. And what was the second part of the question?
Stress relief, stress relief.
So facials. Okay, I would call up my girls some days and say, hey guys, we need a girls' day and facials. Or my friends will call me and say, hey, we haven't seen you in 2 months. We know you don't have an exam this weekend. Let's get away to a beach. Sometimes it was more along the lines of just putting on some really fuzzy slippers and getting some hot cocoa and sitting in front of a TV and binge watching some Netflix. Just taking some time for you. If you are feeling like you don't know what to do or can't figure it out, set your time aside. Time out your week. Know where you're going to have an extra hour or two if you're going to get up an extra hour early or get to sleep in an hour later. Set those times for you. Just make sure you schedule time for you.
Okay, another couple of questions from Denise and Dawn that I think go well together. Denise asks, how should a student respond to a nursing program that claim there's liability or they have a concern about their reputation with respect to the hospitals? And then Dawn asks kind of a companion question, what kinds of units or what type of units have you worked on?
Okay. So on the units that I've worked on, I've worked ICU, pediatric observation, and COVID ICU step down. Those are units in actual hospital that I've been a part of. Outside of that, I was a camp nurse director for a special needs camp in New Jersey. I was a case manager for over 115 cases here in New York City with a major, it is a long-term care program. And now I am a school nurse for kids K through 12 here in New York City at a private school. So those are all the hats that I've worn there. And then in terms of how does a student respond? A student does not take no once they have an acceptance letter. If you have been accepted to a program, I was accepted to my program based on grade merit. So my merits were all of my prerequisite courses. I got in, and when they told me no, I had already know that they could not take away my acceptance. They needed to figure it out. So schools that do in-person interviews are kind of like fading out, but if you are a part of a school that does an in-person interview, you need to make sure that those biases are checked at the door. You need to make sure that you're not discriminating during an interview and you're not looking at their disability as a part of a hindrance versus something that could be an asset. And that comes from training. That comes from training within the institution, making sure that we understand how we're addressing disabilities. What is disability etiquette? Are you training your teachers to understand disability etiquette? And then your students that are coming to your program should not be having that problem if your teachers are educated on etiquette, right? This is not something that should be happening, but if they are faced with it, don't take no for an answer. If you already have an acceptance, make sure that you take it up the chart. Start finding a diversity and inclusion officer, speaking to other people on the campus that can possibly have your back, understanding that your right to education is part of the ADA. That is federal law. It's not going anywhere. So once you have that foundation, you just have to have the grit to fight through it.
Okay, just two more questions, Andrea. From Thomas, what would you say to someone like me who wants to be a voice for, I think he means students with disabilities on their college campus?
Well, where do you start? If you have no idea where to start, I usually tell people to find your student government. Talk to someone on your student government. Maybe someone would be able to help you have an event or be a part of an event where you can have a voice. Maybe connect with your disabilities office on campus if you don't have one. Go into that office. Maybe there's something you guys can do, host a webinar. Maybe we're not on campus, but if you are on campus, go into the offices. If not, send an email to your directors or find out who is your representation. And if there's none, even better, you start it up. You get to be the voice. You get to say, these are things that we need. These are things that we would like to have. These are things we would like to see on our campus. I want to feel included. I want to know that I'm a part of my peers and that my peers see me and that they know that I'm here and I have questions and they have questions and that can be answered this way. So just have the voice, make a path for yourself, and just find out others who will have that voice with you.
Okay, Andrea, last question. I just want to say really what an incredible testimony. And as we talked about when we met prior to this event, how honored we feel to have you here. How can we, from where we are, so whatever our roles are, how can we make it so that others won't have to work as hard to achieve the milestone that they've set out for themselves? I think what you've pointed out is that you had a lot of determination and tenacity. And I wonder if there's a way for you not to have had to work so hard. So I would love to hear your thoughts on that.
So a way to just be inclusive and equity and all of this, ability to open up starts with checking one's bias. And we kind of have to be aware that we're projecting our own presumptions onto someone. When we automatically look at someone and say, oh, they would never be able to, or I've never seen it done. Okay, so if you've never seen it done, are you willing to give it a chance? Are you willing to be there to brainstorm with that person to make sure that it can happen? And if it really can't happen, what is the next option? If it really couldn't happen for me, I was left in the land of limbo. No one was able to say, well, you can go this direction or this can work out. It was automatically shift gears to a whole new career. I don't want a new career. I wanted to be in this one, and I just needed someone else to walk it through with me. We know that their answers aren't going to be out there for everyone, and that's okay. But we need to at least say we're going to give it a try. We're going to give it an opportunity. We're not going to automatically discredit someone because of the fact that they have a disability. I love to say that people with disabilities are innovators because guess what? We live with our disability every day. We know what we can and can't do. We know what things we are willing to push and what things we are willing to say absolutely no to. So it shouldn't be someone else's determination to say that for us. So in order to make things easier to achieve, we have to be able to say, well, yes, it can happen. Let's figure it out how it's going to happen. And if it really can't happen and we just haven't gotten the technology to get there yet, let's figure out a different path than the one that we're currently on, whether that be clinical practice, only education. How do we get you past the clinical points? Because all of the clinical things in nursing is made up by nurse case managers on units. And everyone has different requirements, like lifting 65 pounds is not a requirement for every hospital, but it's there and they're there to weed out certain scenarios. So if you can't lift 65 pounds, why can't you use a Hoyer lift? It's a part of our jargon. It's a part of the way we choose to see things. If we stop putting out this presumption that someone can't do it, then we'll start to be able to create a path that's easier for everyone.
Thank you so much, Andrea, for your time with us today. And sadly, our time is coming to an end, but just such a special message for students that are out there listening, but also for faculty like myself, administrators, really challenging folks to think about those no's and trying to figure out how to turn them into yeses. I love that part. I love your whole story, but that resonated with me as we're working with students. Like, why does it have to be no, right? Let's figure this out. So thank you again. And I did just want to remind or share with everyone that's still with us that we have more time with Andrea this evening. So at 5 o'clock, so you can take a quick little afternoon coffee break or stretch break. And if you can hop onto Twitter with Dr. Pam Lester and Dr. Keith Curry at #EquityAvengers for for the hashtag equity chat, where they'll be continuing this conversation. And so hop on that. We'll put it in the chat as well so that folks can join that too. So thank you so much again. We appreciate you.
Yes, thank you so much for having me. Please, everyone, you guys can find me online. I will type it in the thing.
Yes, and where we can find you at on Instagram for sure at The Seated Nurse. So let's throw that handle in the chat as well, so folks can follow along your journey and all the work that you continue to do.
It's on Facebook and on Instagram as The Seated Nurse. So you guys just have to type in The Seated Nurse and I will come up.